Thank you for joining us again. Ageless Forever Coffee with Doc, episode number 51. We got a place that Nevada's pretty kind of famous for, Area 51. So that's why I brought in Dr. Nate Ellis, right? So he might be from another planet, the PT planet. But
Yeah.
Dr. Ellis is back with us again, and we're grateful to have him. Boy, we got into a great conversation, and we had to end it because it was getting too long. So he was gracious enough to come back, and I think today we're going to talk about modalities, right?
Yeah,
Some of the
I
cool
came
modalities you got.
yeah, I brought over some of my cheat sheets to kind of reference those a little bit because there's a lot to kind of dive into when you talk about those. But first of all, thanks for having me back on the show.
Yeah,
I had a great time last time. It was fun kind of, just talking shop. So
yeah.
I appreciate
No,
that.
it was great. So, well, I could put our filmographer on the spot. Do we know how many followers we had or any views we had on that episode? Do we have any clue? No, we don't know. All right, we're gonna have to look at that though. I think that was a pretty good one. So,
Oh, yeah.
hey, the best one we had was when I had my buddy who was a veteran here for Veterans Day, and he was so that was a really good following on that one.
Yeah,
Yeah,
that's good.
it's good topic, but this is a really good topic as well. So,
Well, hopefully we can make it, hopefully make it
yeah.
valuable and insightful for some folks. So,
So number one, yeah, we something that we use here in the office for a different purpose is the extracorporeal shockwave therapy, ESWT. I call it extracorporeal sound wave therapy. And the reason I do that is because when we use it here, we use it for improvement in blood flow in the penis. And then people hear that word shock and they're like, you are not going to electrocute my penis.
yep.
So we use sound wave therapy. However, I know that it was really derived in the PT world. That's where they figured it out.
Yeah.
And,
So
you know,
they've got a lot of applications. I mean, the biggest thing it does, or one of the main flagship things of the modality is it increases blood flow. So yeah, talking about erectile dysfunction, that's a blood flow issue, but also a lot of other tissues in the body need blood that they're not getting, including like tendinopathies, tendinitises, even like certain phases of bone healing and things like that. We're talking about getting blood flow or modulating blood flow to these areas, and that can be really helpful tools. So yeah, the focused extracorporeal shockwave is one of our more elite modalities that we have. It's probably our most, it does a few things. It's probably our most intense as a patient receiving the modality. However, with that intensity, there's a good trade off. So it has a very powerful analgesic effect or a pain relieving effect that comes after the fact. Obviously, while you're receiving the treatment, it hurts, it can be uncomfortable. Um,
I'll tell you this, it feels like a toothache in a joint. So have you ever had a real bad throbbing toothache? They find that spot in that joint that they're working on. That's exactly what it feels like. It is I don't know, dull, sharp mixture of pain and then it just goes right down the bone. Um,
It truly is undescribable,
yeah.
although I have had patients even describe it as like, this is my pain reproduced. Like the reason I'm coming in to see you, this is making that pain kind of be felt. But then afterwards, and it's a short treatment, we're talking 2 to 5 minutes. It generally runs off of, you set the handpiece to a certain number of taps, but generally our treatment for us is anywhere between 500 and 2,000 taps, depending on the severity of the issue and kind of however much stuff we want to squeeze into that session, right? We got to kind of juggle that as a practitioner, what cost benefit analysis.
Mhm.
So generally short treatment hurts while it's getting done, but then afterwards there is like I said, a big reduction in pain. And generally with that pain, there's some improvements in some regard, like for example, range of motion. So I'll use this analogy, not analogy, but example of like somebody with a rotator cuff injury, stiffness in the shoulder and pain with moving an arm overhead. We'll shoot the like long head of the biceps, for example. That's a pretty common culprit with that. Hurts, get the treatment done, and then afterwards I'll ask them to, do some movements. And generally their range of motion is like, hey, that's better than it was 2 minutes ago before we did that. And then there's also like a decrease in tenderness to palpation, just moving and touching the area. It feels less sensitive. So
Mhm.
um, that actually happens through a pretty unique mechanism that I think is unique to shockwave therapy that I haven't heard about in any other modality doing, and that's lipid cavitation. So your phospholipid bilayer of all of your cells, it causes microbubbles to occur in that lipid layer, and those microbubbles kind of popping and erupting, they start interacting with substance P, and some of your other inflammatory cytokines, and it kind of eats them up like Pac-Man. So there's less of them floating around, signaling other messenger cells to secrete more inflammation. So that's the main mechanism of how the analgesic effect takes place.
That's unique to the focus versus radial.
From what I actually was doing a little bit of digging before I came over just to make sure I have all my stuff, and it sounds like that actually does occur with the radial as well. But I think that I mean, the difference between the radial focus and the focus is quite a bit,
Right.
in terms of just the depth of penetration and intensity and the overall feeling of the machine. So we didn't get into it yet, but we have another machine, the radial shockwave therapy, which I often describe as like the little brother to the focus. So whereas the focus is a deep penetrating achy sensation that feels as though it's coming from the inside out, the focus or the radial shockwave is different in that it's definitely a superficial tissue and working on those superficial layers. So it feels more like a powerful, punchy Theragun, very percussive. It has different attachments that can be used for various body parts. For example, if you're working on somebody's glute, there's a lot of tissue there, a large surface area. So there's a attachment that meets that need. If you're working on somebody's fingers, there's an attachment for that as well. You wouldn't want to use the same thing for a glute for a bony finger. So there's ways to kind of meet you where you need to be with the application of the treatment. But then, yeah, the experience you get when you're receiving the treatment is a lot different as well. So a lot of people say the radial shockwave kind of feels like a rubber band is slapping them a few times, or
That's if you get it off if you don't have good contact on the
Exactly,
skin, you get that slappy.
I find it could put more
Right.
pressure through the handpiece.
And then yeah.
I use it more like a eye stem tool,
Mhm.
like a scraper, and kind of manipulate the tissue with that. And it tends to kind of mitigate the slappiness of it.
Yeah, it's because it feels like a tiny little rubber band snapping. And then that's like when we use it for erectile dysfunction treatment, you need to the practitioner knows to keep good contact on the skin with good enough pressure, because nobody wants to be snapped in the penis with a rubber band. And, it's like, ow.
Do you happen to know which attachment you put on for the DDA
I
treatment?
mean, we just have
Is it stainless steel or
yeah,
composite tip?
it's a stainless steel tip, but we have a cover that goes over it. Is it because of the area that we're treating, we have to have a new cover for each
Oh, that makes sense.
patient, right? So you don't want to potentially transmit,
Of course.
any
Yeah.
from one person to the next.
At the doctor's office, too,
Right,
right? That's
yeah.
a bad look.
Yeah.
So, but those two shockwave therapies are very kind of on the rise, I would say, across a lot of physical therapy clinics and across the country. I mean, they're definitely getting a lot of action on social media, and the exposure of the modality is becoming then. And I think just the accessibility of the cost is becoming more reasonable for
Yeah,
your
the focus is much more cost.
Yeah, to my understanding, the radial shockwave you can get into a pretty nice device for around 10 grand,
Yeah.
for your clinic.
Mhm.
The focus, you're looking anywhere from more like 40 to 80,000, depending on the device. And then there is some overhead and upkeep affiliated with those as well. For example, we have to send off the hand pieces about every 4 months.
You guys run the heck out of them.
We actually got a email from Kenneth, the owner of the modalities, or the manufacturer of the modalities, and said that we use the most in their company.
Yeah.
So
Yeah, I mean, it's run every hour, probably on 2 to 4 patients every hour. So I mean, it doesn't have much downtime
no, it doesn't. And I mean,
at your clinic. I know.
we use it all the time at our clinic. And I mean, again, we like it because it's short. We can, and the benefit is really blood flow. So it's not really like it's contraindicated or not useful in very few instances, So like obviously contraindication, pregnancy with everything,
Right.
malignancy with everything. So then you got to kind of then use your clinical reasoning to decide, okay, like with the shockwave, you're inducing like a percussive impact, like growth plates could be a concern. So then you want to stay, you can use it on a ped, but you want to use it on the mid-substance muscle bellies, avoid like the long epiphyseal plates of long bones and things like that. So, there is some potential risks and some considerations to use when you're doing it, but largely it's very safe, and it's directed largely at improving blood flow for 99% of the things that I see in clinic, that will help the problem.
And I would tell patients that, with the radial head, and we have 2 of those, I said, there's no way we can hurt you with this unless I hit you in the head with it.
Right.
Pretty much is, and it,
Now we can make you uncomfortable. Don't
yeah,
get that mistaken. We can definitely take the machine to a tight that it'll elicit pain. You'll say, "Ow," but it's as simple as turning it back down, and we've done no damage. It was
right.
just we just exceeded your tolerance, and we happen all the time in clinic. I do it almost every day.
Oh, it's
I
part of PT. You got to find out what somebody can tolerate
and
and
that
take them to that.
And it's exactly, and it morphs throughout their treatment. So you can expect the first time you come in and I run that machine on you, it's like, this is alarm bells are going off, and I have to turn the machine pretty low, relatively speaking. You come in on your sixth, seventh, eighth visit, you've had that machine those last 6, 7 times. Now you're like taking it to higher levels, and it just is indicative of improvement in the tissue. And that is another really cool thing I'll segue off of is you can actually see tissue change from session to session. Like, for example, our Sir Doc here coming over had some real stiffness in his shoulders, and the muscles just felt firm and fibrotic. Well,
Robotic.
the acoustic wave machines have made him much more supple leopard. You know what I mean?
Don't watch me move though. I'm not very supple leopardy, but it did. I'm nowhere near the amount of pain. And I do have a lot more range of motion than I had
Just the
previously.
tissue quality. Yeah, he just the muscles feel like muscles again. They don't feel like rock. Not that you don't want your muscles to feel like rock, but
No, but it's just when they're not being flexed, they don't need to be
exactly.
that hard, right?
Exactly.
It's not that. Therein lies pathology. When the muscles are hard all the time, there's some pathology there.
Yeah.
And if you're walking around flexed all the time, there's pathology there too.
Yep. And then we'll segue to another cool modality. This one's more of an adjunct to something else, I would say. So it's a PEMF mat, pulsed electromagnetic frequency mat. Oftentimes, those will be paired with red light technology. This is essentially going to elicit or create a electromagnetic field in a cylinder shape around this mat that goes on like a treatment table, or I have patients that buy them and put them on their bed, put them on the floor, different things. But you just lay on this, and that electromagnetic cylinder encapsulates you, and then it can do some really cool things. For example, our brains emit frequencies relative to the state of consciousness that we're in. So when you're kind of in that drowsy limbo state, you can kind of hear somebody talking in the kitchen, but you don't make out what they're saying, or you're in the deep, deep sleep, or you're really wired and alert. Each one of those pairs to a different wavelength your brain is emitting.
You're
You
talking
can
about your alpha, beta,
beta, theta
delta.
waves. Yep, delta
Oh,
waves.
mm.
You can match the mat to pair with those same frequencies. So it's emitting that frequency. It's not necessarily changing what your brain is emitting, but several minutes on that mat, and you'll start to reflect what the mat is set at. So if I set it to be in a relaxing, for example, delta waves, deep relaxation, sleep through the night, help with decreasing feelings of anxiety or stress, people will start to feel that way. They'll be like, man, I'm starting to, and it's like, that's the mat at work right there. It's pretty cool. So we'll do a lot of like stretching on there, or if people are getting a lot of cervical work, we'll put them on there. Cause again, you're getting a nice supplement of heat as well. Heat promotes elasticity in muscles and increases blood flow. That's it. There that it is again.
Yeah.
So that's another one we use. Again, not like something I would say is a mandatory or essential in any clinic, but if you have a means to add it in and then you can layer other things on top of it, it's just a nice way to add 5, 10, 15% more to what you're already doing. Just kind of levels everything up a little bit.
Yeah. I remember when these first came out, and it was borderline on a little hooiness. You're kind of going,
Yeah.
does it work? Does it, and I was like, well, I'm skeptical, but if you think about it, at less than a cellular level, at a molecular level, we are all just electric charge. So why would it not work?
Mm-hmm.
As opposed to how, why say it doesn't work? Tell me how it's not working if all we are is electrical charge. All matter is electrical charge compressed, right?
Yeah, and I mean, right now you're kind of almost in line with how I educate patients on my dry needling with electrical stimulation. I mean, we're electrical beings. It's all governed off of electricity. If there's no electricity in your system, you're dead. And so we can use that electrical current to manipulate certain things. Again, water and electricity react with each other. So we can then think about if you have swelling or inflammation, that fluid content has water involved with it. We can help drive that hydroelectric field or move that water around based off of how we have current flowing through this tissue. So, if I want to decrease swelling, I can set up needling in such a way that it kind of helps promote to draw fluid out of a structure. But yeah, I think electricity is a huge linchpin to pull if you're stuck with a patient or if you're feeling like, I need something more. Electrical modalities are a good option.
Well, I mean, the needling itself, if done appropriately, right, has its own set of benefits.
Yeah.
Right? So it's essentially acupuncture,
Mhm.
right? And so I said this years ago, but people don't do things for centuries if they don't work. Maybe 100 years or something like that. Like we were bleeding people, and guess what? That's kind of back in vogue now, doing phlebotomies and things of that nature. But acupuncture has been around for centuries,
Mhm.
and I remember before I went to med school, I was, they before you take the MCAT, they're like, you got to, read stuff outside of textbooks, but read scientific articles and things of that nature because that's gonna be part of the MCAT. You got to, be ready for that. So I got a subscription to Scientific American, and one of the articles that I'll never ever forget, it just stood out to me because it really, now that I step back, it really embraced the essence of kind of what it is to me to be an osteopathic physician. But what they did is they did an experiment to show that the needle point in the foot that was related to the eyes was a legit
Thing.
acupuncture point, and that the chi was there. And Western medicine said, well, that's impossible. There is no nerve that comes from the foot that goes to the eye. And and I understand that and I agree. There is no such nerve. So what they did in this study is they brought in a master acupuncturist and they used PET scan. And they brought the subject in and they give him some visual stimulation and did the PET scan and the occipital lobe lit up. Then they blindfolded them, did another scan, and the occipital lobe was quiescent. They left him blindfolded and had the acupuncturist needle the foot, and the occipital lobe lit up just like the vision center. And they did it on multiple patients. And it was, that's kind of a real brief summary of kind of what, but I was like, that is freaking cool. And they had pictures of the PET
Absolutely.
scans and everything. And I was just like, okay, so open your mind. Like,
Yeah.
is, like, and so just to that point, it's kind of a tangent, but no, because yeah, the electricity helps, but the needling itself helps, and then you have the combination.
Right. Yeah. So, I mean, dry needling and acupuncture are more similar than they are different. I mean, we order our needles from an acupuncturist website, so it's the same equipment at baseline. The large differences that I've come across is again in the philosophy behind why we do it. So, in Western medicine, we're going to be targeting anatomical structures and trying to get a physiological response that would be expected from that structure.
Right. So you're looking to disrupt like the Golgi tendon bodies that are misfiring and causing that muscle to spasm.
Yep, change some length tension relationships, change the internal environment around that specific structure. Where you go into acupuncture, like Doc already alluded to, they are very likely going to put some needles in your area where you're complaining of pain or whatever it may be, but then they might go totally off script from what you're expecting and go in your face or your hands or your feet. And that's going to be in line with what they call meridians or these energy pathways in the body. And I think a lot of what works for people is what they believe and what they don't believe. If you already go into the treatment kind of thinking pooey pooey, like I don't really know if this energy stuff is for me, you're probably not going to get the profound results you have. But some people love their acupuncturists and swear by them. And I mean, I can't disagree with their results. And I feel like people who maybe have better results with dry needling, it might just be because they can buy into the Western medicine philosophy a little bit better, and they already have a little bit of a belief like, oh, this might help me. I think that
There's something
our
to that as well.
yeah, I think that our mental state going into something has a large predictability of our outcome coming out of it. Um, but dry needling and acupuncture, both a few reasons why they are effective. When you put that needle through the skin, you're passing through the, the epidermis, the dermis, the subcutaneous fat, the fascia, the muscle, the bone, in some instances, the bone. And all of those tissue types that you just passed through have picked up on an external invader has entered the system, and they're communicating with the brain saying, hey, there's a foreign body in here, like we don't know what this is, we need to send in the cavalry to fight infection, and basically send in all these healing factors, and that kicks off a whole cascade of events that already starts setting up that internal environment better for healing. The other thing it does is my thumbs can only get so deep and be so precise. When you hit that needle spot on the money with that bingo, they call it an ah-shi point in the dry needling literature, or just a deep, achy kind of dirty is another one they call dirty, deep ache, but it elicits a bony, a kind of achy sensation, and that just means you kind of hit the money spot. And generally, after that treatment, there's going to be a benefit of some sort, whether it's range of motion or decreased pain that follows. But very powerful modality, very cool, relatively safe, well, largely safe. There's a few precautions you have to take into account for that, but if you're trained and you're not just winging it, you're following the rules they teach you, it's very safe.
Yeah, that's I found it to be very effective as well. I usually, and it just w- when we get into my the posterior aspect of my shoulder is usually a spot that gets in the muscle just is in spasms around that. It's you know
Yeah.
it's but when it releases, you're like, oh, thank goodness.
Oh yeah, when you hit
Mm.
the spot and it lets go, it's like a big change, and
Like
everybody's happy.
when the tissue just goes poof. Inside joke.
Yeah, little hat tip to us there. That one's on recovery. This one's a good one too. I think it's also kind of falls in that same wheelhouse as PEMF, in the fact that it may or may not be obvious to the patient how it's working, and that's red light therapy, or um what is it, biomodulation, photo
So biomodulation, it's also low intensity laser.
low intensity laser. So um there's a ton of evidence that supports the efficacy of red light. I think the biggest drawback for it is that you don't feel anything happening, nor do you feel anything different afterwards. It is a dose dependent modality, meaning the more you do it, the more you're going to get out of it. That doesn't mean that doing it once doesn't have any benefit. I think just understanding the mechanism of how it works also kind of helps people understand like why it's useful. So I first, when I'm explaining red light, I talk about the visible light spectrum, Roy G. Biv. We go all the way from red to violet, and on that spectrum, we can kind of think about what we know about light and how we use them in our world today. So on the UV end of the spectrum, we're talking about how destructive it is. It causes cellular cancers like skin cancers. UV exposure is a big concern. But then also in recent years, we've come out with, UV sanitation beds for your phone, or we'll use UV light in wound care to sanitize wound beds and kill off bacteria we don't want. So I think of the UV light spectrum and the far right end of the spectrum as being destructive or harmful to cells. On the other end of the spectrum, I think of it as being rejuvenating and kind of breathing lifeblood into things. So it's very much kind of how red light works. So red light interacts with your mitochondria, which is in all the cells in the body. And if you think back to high school bio, the classic mitochondria is the powerhouse of the cell. That red light interacts with the mitochondria and essentially gets more workers working at your power plant, your electricity plant, and every cell in your body. It works systemically. So there are some concerns with, like, if you have malignancies and those types of things, it's probably not a smart modality for you. But when you're just thinking about recovering and trying to rehab or heal from something, getting more hands on deck doing the work internally is going to get you from point A to point B that much quicker, which is again why we like it. It's not a make or break modality. It's not going to be the difference between you getting back in 6 months versus 9 months, but it adds 2 or 3% to every little bit we do. And that, or if you stack enough of those together, you get a nice chunk of your pie back, and it does make a difference.
As the cheapest red light therapy is early morning sunlight. So,
Mhm.
and I understand why you said what you said, and I will just counter with, um, even with somebody with malignancy, would even tell them not to get in the sun, early morning sunlight. And I don't even care if they had skin cancer. Early morning sunlight, those rays, and they're not the UV rays. because of the angle of the sun to the earth. And so all you're getting is these red light, kind of in there, a nice low dose, 10 to 15 minutes. I mean, shoot, we've utilized sunlight for therapy going back,
Forever.
forever. I remember my mom, when she was a little girl, had tuberculosis, and then and they put her in a sanitarium, and they'd be like, no, they take us out and wheel us our beds out and leave us on the porch, and even in the freaking wintertime. But it was get some sunlight, get
Mhm.
for all of its benefits, right? So,
Absolutely.
um, but yeah, that red light therapy is really good, and listen, there's red light therapy laser hats to help with hair growth. Why? Because again, it's blood flow. It's opening up those blood vessels, right? So if you can improve blood flow to the scalp, then you're improving blood flow and nutrients to the hair follicles, and you can help the hair grow. So you can see Nate's been using one of those hats for a while. I haven't.
Oh boy.
So
So I knew
so
one of those was going to sneak in on this one.
yeah, I had to. But the other thing I wanted you to do, because I heard you say it the other day, and I think you were talking to one of your patients that played in the Little League World Series, a local kid here. And I meant to say something to you afterwards, but you did an amazing job of explaining to him the macronutrients of carbs, fat, and protein. It was really your protein thing, but
Oh man, I wish I could remember what you're
oh,
talking
geez,
about.
because you were talking to him really more about protein. You're like, well, protein is all the things that we can
Oh, all the
touch.
things of substance,
Right.
yes. So it's
Right.
kind of, I mean,
Trying to
I'm talking
stress
to,
to
I'm
him.
talking to a ped, I'm like basically everything that has substance that you can touch in your body is comprised of protein. And so, he's dealing with an ankle fracture right now and trying to get back into baseball. And, dad's there in the appointment talking about, well, what's important here, sleeping, drinking, food, all that kind of stuff. And so we're just kind of going over all the boxes to check to make sure that he's going to get back on timeline and come back at the level that he wants to come back to. And so one of the things we were talking about is, making sure that he's eating enough of the right nutrients. And the biggest nutrient, and when we're talking about healing, to have on deck is protein. And then, it goes into the whole talk about, well, how much protein. And then there's a common, I think a lot of people say 1.5 grams to 2 grams per pound. And then that's typically incorrect. It should be per kilogram of body weight. And
Mm.
so I kind of help provide that information for him. And yeah, I know I didn't get to say it as eloquently as I did in the clinic there, but that's what just
No,
really made it natural in the moment.
no, it was great. You have a lot of eloquent ways to explain things to your patients because I'm an observer. When I'm in there, I listen, and sometimes I want to interject with some smart ass comment because that's just my nature.
Yeah.
But at certain times I go like, no, just keep that one to yourself because it was beautiful. So
Yeah, I always get a little nervous when in there. If I'm gonna say the wrong thing, you get called out on it, but I'm always ready. Stay spry. No, it's
so
good. Between you and Scott, I'm always got to stay on my toes. First day I got hired there, he walks up to me. He goes, "How many muscles attached to the scapula?" Oh man,
that's a good question. Right?
never been asked that.
You see all your shits muscles, and then
So then I went.
yeah,
I got 15. Do you know how many there are on hand?
mm-mm.
17.
Okay.
And I was like, "This is gonna be tough." That's for day one. He's grilling me on these.
Yeah,
So
I had like, I didn't have, I had like half a dozen there,
yeah,
There's
torcal brachialis and omohyoid. If you were curious of the two, I forgot.
omohyoid. How the hell is that attaching to the scapula? I have to review my anatomy.
Yeah,
It's going all the way around, huh? Okay.
and
I'm not arguing it. You had to look it up probably. So
did because like with the list, and Scott goes, "There's two more," and I'm like, "What two are they?" So then I just literally had to start going through, and yeah,
yeah,
omohyoid.
getting pimped like that, and you'll never forget it.
That's
You
stuck
know?
up here.
Yep. So anything else you want to discuss
Hmm.
on the PT front?
No, not a ton. I mean, we do have other modalities. If you guys are in town, I'm gonna come and check them out. We have some other really cool kind of like somebody as if they took the TENS unit back to the lab and made it better. It's called the ARP Wave and RX Black. It's a cool modality that they have revamped and reworked because traditional electrical stimulation units, functional electrical stimulations units, TENS units, those things, they've run a single waveform that has some limitations kind of built into it just by physics. So if you take that waveform or you take up the intensity of those machines to a certain threshold and you're going to induce tetany in the muscle, it's just going to completely lock, and that's very painful for the patient. And then at that intensity, you also have a fairly high risk of a cutaneous burn from the pad. So they've reworked it, and now their systems run a dual waveform. One of them they call the physiologic waveform, and then the other one they call the I'm drawing the blank on it, and I don't want to misquote their technology, so I won't worry about that. But basically, one waveform you feel very similar to the TENS unit or the other modalities that I just discussed, but the other one is kind of running in the background, and you can suspend the main pulse that you feel, and ramp up the other one all the way to 10, and they don't feel it. However, the evidence that it is working is that you can unsuspend the main pulse, induce tetany, but it's not painful. It's just intense. And the patient can move in and out of the tetany, which is interesting. And then there's virtually no risk of burning the patient with this technology, too. And I've had some really profound results with some people who've had kind of fixed neurologic issues. Like I have a patient who's had foot drop for 7 or 8 years,
Mm-hmm.
and we're getting toe extension. We're getting some dorsiflexion.
Oh, wow.
It's really cool.
That's really cool.
Yeah.
Yeah.
I've had one patient who had like, a trace amount of scoring a trace, like a 3 out of 5 MMT score on, again, foot drop,
Mm-hmm.
dorsiflexion. Now she's up to like a 4 minus. So it's improving. She can move load with the foot. So, I mean, again, we go back to electrical beings. A lot of times with a situation like foot drop, as long as, it can be either from the low back or a peripheral nerve injury, but depending on what kind of nerve injury, if we can stimulate that nerve enough, we can get some juice to kind of come back out of it. And if we can get enough juice to the muscles that it innervates to kind of help strengthen them up, then you can get that anterior tib and things kind of firing more than you were before. And it just, I mean, same thing we've always done with functional electrical stimulation, but it's just this newer technology kind of allows for some more range and application.
So my question is, in those individuals, and it might be different for each one, but what was the initial insult that caused the foot drop? Was it a stroke?
One patient it was a stroke. The other patient it was a surgery on her calf.
So they got the peroneal nerve, probably. Okay.
It's a clip.
So, so it sounds to me like that, especially in the stroke patient, that feedback is going back centrally and firing some neurons that were otherwise quiescent.
Yeah,
You
absolutely.
know,
And because again, this machine has 4 potential leads. You don't have to use all 4, but typically with electrical stimulation, including dry needling, they advise do not cross the spinal cord with these. This one, they tell you to cross the spine, to put it on upper extremities, lower extremities, and have them make an X pattern. And it feels weird. You can feel that current like coming up through your abdomen and doing, but then you do things like, and you move with it. You do exercises with it.
Mhm.
You do, it might be as something as simple as diaphragmatic breathing on the table for somebody who's like in super bad low back pain. It might be a high intensity Olympic lift. You can do both. It's really kind of geared. And then they have a, a massive list of protocols that you can follow, and they're geared towards everything from neurologic conditions to sports recovery conditions to post-surgical conditions. And that really kind of initially, when I was first learning how to use the machine, that really helped give me some training wheels and kind of figure out how to use it. Now I kind of understand which the frequencies go for and how I can kind of go off script with that and get a little bit more personalized treatment.
Nuanced, yeah.
But very cool. And I mean, just the results kind of speak for themselves at that one. So that's a very cool one that I don't have a printout for that one to go over, but it's a good one. And if you guys are in town, come check us
Yeah.
out. We got some good stuff.
Yeah, they have a lot of modalities. I mentioned this the last time. I've been going there for a few years because it, it's just where I go for my tune-ups. On a biweekly basis, I'm a big believer in getting some body work done. It keeps things moving. Um, but I will say this, that going to Prism Physical Therapy and watching Nate and the other physicians, you know, PT doctors over there work, they're not just checking boxes to get paid by an insurance company because they don't accept insurance. They're actually trying to get you better. They prefer not to see you again, but they just love their patients. They love to having them come back. And so it's not in a negative way. They prefer that you be better and be gone. Right.
Absolutely. I mean, again, we're cash pay. So if people aren't happy with the product they received and they don't come back,
Mhm.
you know, and that's one of the things when I was getting into it, I was kind of like, it's kind of expensive to ask people to come and do this. But then again, I kind of, after I saw what I'm doing and I feel like, no, I totally think our price point is acceptable and a good price
Sure.
point because it's, I'm not selling you crap. I'm selling you a quality product. I'm taking the time to learn what your problem needs, and then I'm only going to implement the things that we've discussed together, and we have made the joint decision that yeah, this is going to be beneficial to you. And then if if for whatever reason if we need to modify that plan or shift gears, we do that on the fly. But I mean, I love what we do there, and I think that our results do speak for themselves. We have really good results.
I concur. I've seen a lot of it. I've had a lot of I refer pretty much all my patients with musculoskeletal issues there, right? And then we work in conjunction with them. So if they reach out to me and say, "Oh, doc, this one's a little different. Can you get us some imaging?" We get it. I mean, shoot, we caught a bone cancer
Hmm.
in one patient. I think we've caught a couple things that, as an individual practitioner, without that team, we wouldn't have, right? And really, it was all to the benefit of the patient to get them in the right, like, oh, look, we found this, let's go, because the math wasn't mathing, right? And so the the collusion between us is the right word, I guess, but working together, uh, at least for my patient populations, has been excellent.
No, yeah, great. I mean, and I anytime I same thing. Anytime I have somebody asking about TRT or
Peptides,
peptides, I'll be like, I have a guy who's better to answer these than me, but he's right around the corner. You should go talk to him.
yeah,
And yeah, it's a very symbiotic relationship. We got a good thing.
yeah. All right. Well, thank you for your time.
Oh, thank you.
Thanks for coming
Love coming on
by.
the show. Yeah,
We'll,
absolutely.
we'll see if we can talk about something else that you guys do different there, right?
Yeah, we'll scratch our brains, come up with something.
So, but I think is today the last day that you're working there, and then you're off to your honeymoon.
No, I got tomorrow to go, and then I'm off.
All right,
St. Lucia bound.
there you go.
Thank you.
Congratulations, you guys have a
Excited.
beautiful time. Safe travels.
I will. Thank you.
Thank you for joining us. And if you have issues, physical therapy could help. I strongly urge you to consider Prism Physical Therapy here in Las Vegas. Thank you, and we'll see you for episode number 52 next.
Bye, guys. Thank you.
Fun.
Awesome. Yeah. Thanks, Doc. Always.